My name is Greg Williams. I'm a plastic surgeon and a full-time hair transplant surgeon at the Farger Hair Institute. I was born in Kingston, Jamaica, and grew up there, but was educated at boarding school in Toronto, in Canada, university in Montreal, at McGill, and then I returned to the West Indies to do medical school and came to the UK to specialize in surgery, and following that in plastic surgery. I always wanted to be a doctor. From the age of 11. I decided that's what I was going to do, and all of my education was geared towards that final goal. I initially trained as a plastic surgeon with a subspecialty in burn surgery, and I worked in the National Health Service for a decade as the clinical lead at London's Burn Centre at Chelsea Westminster Hospital. And it was during this career that I was exposed to patients who lost hair through their burn injury. And the methods for correcting genetic male and female pattern hair loss are the same. And that's where my interest in hair loss came from. There are two things I really love in my job. One is immediately after a hair transplant surgery procedure, when patients see what the potential is going to be like and they go, wow, that looks amazing. And then when they see their final result, which can take a year to a year and a half, and the transformation often is quite incredible. And the stories that patients tell me about the difference that it's made to their lives, to their confidence, their self-esteem, to their ability to start relationships, to more confidence at work, and just generally life. A hair transplant can be life-changing, and it's amazing to be part of that process. I think patients value my honesty and my direct approach. I'll say it as it is. If they're suitable for a hair transplant, I'll explain that to them, along with the advantages and disadvantages and the implications of having a hair transplant. But if they're not suitable for whatever reason, they're going to get that straight from me. I really value the trust that patients put in me when they allow me to operate on them. At the end of the day, I'm going to be changing their appearance, and that's a real responsibility, which I take really seriously. The main challenge day to day for me when I'm consulting on patients is to try and predict the likely extent of future hair loss in those with genetic male and pattern hair loss, because somebody who is likely to have very advanced hair loss might not be a good candidate for transplant at all. The younger a patient is, the harder it is to make that prediction, and the older a patient it is, the easier it is to do. And I have patients, male patients, coming in their 70s and 80s requesting a hair transplant, and you're never too old to have one, and it's an amazing procedure that can be life-changing. I regularly say to patients that having a hair transplant is not about vanity. A lot of people feel ashamed that they're coming to have something done, and then they say, oh, doctor, you must think I'm vain. Not at all. For me, loss of hair results in loss of identity and loss of self-esteem, and quite often that results in loss of self-confidence. So no, for me, a hair transplant's not about vanity. It's about recognizing the image that you have about yourself. Surgery is inherently a stressful profession. So if one isn't able to deal with stress, one shouldn't be a surgeon. I think in difficult situations, one needs to take a breath, think about the problem and a solution, and then follow it. And in frustrating situations, I think you just have to stay calm and always be professional as a doctor. Hair transplant surgery is sadly an unregulated field, and not all patients have a positive experience. What I would hope patients would say about me after they've seen me and had surgery is that he is ethical, professional, and skilled in what he does.